Yeah, Jeff, we are at Evergreen Commons here for the next chapter in this saga that is healthcare reform. And this venue behind me tonight holds upwards of 1,000 people. And actually, if you take a look over to my right now, you can see them lining up. There are a lot of people here already, and it's pretty impressive because the doors don't even open till 6:30, and this doesn't get underway until 7 o'clock. And Representative Pete Hoekstra says he is expecting a full house tonight. He says he wants a firm understanding of what his constituents want from health care reform before he goes back to Washington, D.C. to begin to fight for it. And one of the biggest problems right now, according to many politicians, is that very few people have a true grasp of what is being proposed in the 1,000-plus page House Subcommittee Bill, H.R. 3200. Now, that confusion has been leading to a number of arguments and disruptions in the health care town halls that we have gone to so far, and Representative Hoekstra is hoping to avoid that here tonight.
There's a great degree of ambiguity in the bill where you think that it says something, but you got to peel back the layers and say, is that what it really says? Does it really mean that? And then you got to go to other pieces of legislation, or your staff goes to other pieces of legislation and says, well, Pete, here's what it says here, but if you go over here, it says something else, so here's what it means.
Okay, that is a mouthful, but for that reason, Hoekstra says he believes most of the country wants to see health care reform taken on in smaller increments, handling one issue at a time like tort reform or improving access. Now, back out here live, once again, you can see the lines forming here at Evergreen Commons. Hoekstra says he hopes and believes some kind of health care reform will be signed into law this year, and again, he is hoping to get a better idea of exactly what that health care reform should look like here tonight at Evergreen Commons after speaking with all of these people. Now, again, the doors open here at 6:30. The town hall meeting begins at 7. We will be here throughout, and we'll bring you much more information tonight, live at 10 in the CW and live at 11 right here on CBN. We're live in Holland. I'm Jared Hoekstra, News Channel 3.
In a little more than a week, lawmakers will return to Washington, where they will continue to debate health care reform.
Town hall meetings have been held across the country, including West Michigan. And tonight, Congressman Pete Hoekstra hosted a forum in Holland.
WZZM 13's Lambrini Lukidis reports from Holland.
I agree that there needs to be something done.
The health care bill is long and definitely complicated. Like many lawmakers in Washington, it has Congressman Pete Hoekstra concerned.
I have great discomfort about the wide latitude that the bureaucracy will have in putting this plan together.
People are also questioning just how a government-run health care system will work and help them.
They had to wait 6 months in Canada to see a specialist.
And you worry that that might happen to you if you had a need for surgery?
Yeah, really. I mean, I think the elderly people ought to be concerned about this.
The crowd had many questions about Medicare, which Hoekstra says is still unclear.
Because we don't know what basic benefit package will be put together by the commission.
There was also tension about tax dollars paying for medical coverage of the unemployed. And at one point, the forum turned into a debate.
Other countries, most of the rest of the industrialized world, we spend 80%, they spend about half that, and most of them have measurably better insurance.
You want decisions made by government employees who are accountable, or by insurance bureaucrats who answer to nobody.
Regardless of how health care is handled, it needs reform, and the majority of this crowd says they would rather have more choices when it comes to their plans.
And that was Lambrini Lukidis in Holland tonight. Now, I'll be talking live with Congressman Hoekstra tomorrow on WJRW 1340 AM.